postpartum depression. It's a silent pandemic that's happening. This is something that goes unsaid, unseen. Why? Because 1 in 5 mothers globally are experiencing postpartum depression. No mother recovers in 6 months. That's just 6 months of corporate telling you come back to work. It takes 2 years for the body to recover from that. And the moment the birth is done, everything just falls. So this is what we call as the hormone crash. And this is the hardest on the human body experience ever. And baby birth is said to bring out some of the highest decibels of pain that has ever been measured. Why? Because you will then be called mad. Your child will be taken away from you. You have a healthy baby, what more do you want? And what about my health? Now this is very, very important. No mother should heal alone. Absolutely not. And this is exactly why we have some places where you can go to seek help. I would be very, very glad if you folks want to take a screenshot of this, keep it with you. And when a mother's going through this, you want to share it with her. When a partner's going through this, when a father's going through this, you want to share it with them, please feel free to do so. All of these are free confidential helplines present across the country in different colloquial languages. Very, very important to find that.
I now invite Dr. Sravannthi Maya to share her insights on understanding and navigating postpartum depression.
Thank you so much, and a warm good morning to all of you, and thank you so much for having me as well. Right, so one request that I would love all of you to have is, let's keep it interactive so that I also know what you know, because a lot of times I am absolutely thrilled to see so many people here. This in itself is a reflection of the fact that each one of you wants to learn more, do better, and be there for people in your life and learn better. So I'm sure you're all coming with some understanding of what this entire topic is about. So if you tell me what you know, then I can add what little I would like to add to the entire context, and that'd be great. And there's also a separate Q&A, so we can take up further questions there as well. That's my dog. He's the love of my life, and that's him. But one very crucial aspect that over the years of doing research is when it hit me, I remember when my aunt, she's about like 10 years older to me, and I was pretty much in my 20s, and I went to see her in the hospital, and she was like, can you just take the baby away from me? I was in my first earlier years of doing psychology. I was like, but like for 9 months, you wanted this baby, no? Like you did everything under the sky. You ate well, you slept well. She was like, please take the baby and go away for some time. And that was very scary because I've never raised babies, so I don't know. I've raised dogs, I've raised cats, I've raised animals. And now I raise nephews and nieces, but I didn't know. And that's when I came back home and I asked my mentor, I said, do you think she's okay? And that was the first time I heard the word that there's something called as postpartum depression. And I'm talking about 2009. And at that point of time, I don't think I had the insight into what this does, because it's a silent pandemic that's happening. This is something that goes unsaid, unseen. Why? Because 1 in 5 mothers globally are experiencing postpartum depression. And this is data from 2023. There are so many COVID babies. There are so many children who are born after 2023 that we see this number rising. Now, along with that, mothers in India, about 4 in 1, that's nearly 6 million women are actually giving birth every year. That's a huge, huge number that we are talking about. And there are these rituals that happen when the baby is born, like they tie the mother's abdomen, or they give her coconut, they give her wet coconut, dry coconut, jaggery, they give her sesame seeds. All of this to build her bodily strength to be able to provide lactation for the child. But nobody ever asks, so how are you doing? Now I'm going to ask all of you, how are you all doing today? Let's say somebody asks you today morning, like, hey, how are you doing? Okay, we are saying good, we are great. this is just one part of it, right? Like this is just the surface level of what it is, because we are all rigged to say the word because socially appropriate responses. So a mother is never going to say that she's not okay because she herself has no idea that she's not okay. And you'll be thrilled to know that when a woman gives natural birth, the cowl, that means the bag in which the baby is, along with the entire content of it, comes out. So once the baby is out, the doctors actually wait for the cowl to come out if it is a natural birth, right? Now, when it is a C section, the abdomen is cut and the child is removed out. Now, what does that mean? A lot of the hormones are still stuck inside the body. Not only is the woman stuck with extra hormones, the body is going to produce extra hormones to be able to nurture the baby for the next 1 year. And when I say hormones, I'm not talking just about the ones that we know. Interestingly, it is said that about lesser than 10% of Indian mothers ever seek help in the entire journey of their postpartum recovery. Now, a question to all you fabulous people who turned up on a Saturday morning at 11 o'clock. It's not easy. Trust me. Not with the lives that we are living. It's not easy to turn up at 11 o'clock on a Saturday. How many of you are aware of how long does it take to recover from postpartum? What do we think is the timeline that takes to recover from postpartum? 6 months? That is the corporate leave approved timeline of 6 months. No mother recovers in 6 months. That's just 6 months of corporate telling you come back to work. It's actually 2 years, and some of you got it right in the chat box. It takes 2 years for the body to recover from that. Now, postpartum depression is one of the most common complications of childbirth, and it goes undiagnosed because, yeah, I have gone through this. My grandmother has gone through this. My mother has gone through this. My aunt has gone through this. Why are you complaining? This is exactly why we are trying to understand that it's like a musical concert, right? Everybody walks out, but after the actual birth, the estrogen and progesterone that were keeping it running. And by the way, do not forget, there's a lot of meconium aspects that happen where the baby, ingests a little bit of the feces, or the baby puts the cord around the neck, or the baby has turned in position, and the mother has to make a choice. Are you going to go for a natural birth, or do you want to go for a C-section? So there is so much of anxiety right before the birth that the adrenaline is extremely high. And the moment the birth is done, everything just falls. So this is what we call as the hormone crash. And this is the hardest on the human body experience ever. And baby birth is said to bring out some of the highest decibels of pain that has ever been measured. Pain is measured in decibels, so baby birth is one of the highest. Now, there is something that this is for all of us, but it happens a little bit more in women in postpartum. It's called as the HPA axis regulation. That means it's the thyroid, the pituitary, the adrenaline, the hypothyroid, the pituitary, and the adrenaline. So when you stand, you can draw an axis between all of them. These three are on an overdrive because they take it as a joke. They're like, I can put a plate on my baby bump and eat food. My baby bump has grown so big. But what nobody speaks about is my kidney is pushed to the side. My abdomen is, intestines are pushed. There is no enough space for me to breathe as well. I don't know, there was a trend that was happening on the internet where a lot of the fathers, when their partners were extremely fully pregnant, 8th month, 9th month, they were lifting the abdomen, and then they realized that the woman just falls back because it is that straining on the back. And did you know that if it is a C-section, there are injections that are given to the mother so that she doesn't feel anything below the second half of the body? And the injection is given to the spine. It's called an epidural. It is given to the spine of the mother so that she doesn't feel the pain. But once the anesthesia wears off, the pain comes and hits you so hard that a lot of the women are unable to stand up. So while we say postpartum depression is here, it's two-way. The physical symptoms cause the mental health concerns. The mental health concerns do cause the physical symptoms. Now, you'll be surprised, a lot of times many people do pass, feces when they're giving birth, if it is a natural birth, because of the pressure on the body. There is embarrassment in the hospital itself. And we also have to understand, a lot of times there is very less preparation. That's what it is said, that when a woman at the end of all of this process is promised a baby, the mother is willing to discontinue or be dissociated to everything that happens around her. But this comes and hits you when you are sitting in the silence with your baby at 3 o'clock and you almost feel like, I detest this child. You are the reason I don't feel closer to my own husband. You are the reason I don't want to have intimacy with my husband. And this is the same child that she took IVF for. This is the same child she went through the entire aspect of IUI. This is the same child for whom she took so many medicines and she prepared her entire body. So when people speak about postpartum depression, I'm like, you're speaking about something that is happening after the childbirth. But this aspect of the depression starts when the idea of wanting a child and the consequences of it are already into the system, right? Now, this is very less spoken of. This is called as neuroinflammation. That means there is a cytokinin surge to depressive symptoms. That means the immune system and the mind are far more connected, where it is telling you've given birth to the baby, you can calm down. I don't know if you've ever seen this. You should see National Geographic when horses, cattle, lions, these big animals, they give birth, they just lick the baby clean and then they let the baby be, and the mother is just sitting aside and waiting for nature to do its thing. It doesn't work like that with humans. You're supposed to clean the baby. The next 10 minutes itself, you're supposed to start feeding the child. There is so many rules around what the mother wants that imagine if the mother were to say, I do not want to do this. Oh, the repercussions of that are pretty heavy. Now, what is the difference? Remember, these are very different things. They might sound similar, but they're very, very different. Baby blues are something that happen in about 60 to 80% of new mothers. This has an onset between 2 to 4 days after the delivery. There is mood swings, there is tearfulness, there is mild anxiety, but I would say there is higher anxiety because you're worried about this little child that just trusts you and came into the world, and you feel this extreme sense of overprotection. You don't know what to do. So tiny, so fragile, is constantly sleeping, puking. You don't even know. Usually, baby blues resolve within 10 to 14 days. There's no treatment per se that's required, but a lot of rest, good amount of hydration. But in postpartum, it's 20% globally, and the number in India is super, super scary, where it's at 25%. It can begin in the first 12 months. It's persistent. It's impairing and doesn't usually resolve on its own at all. It affects identity. There is a saying that no mother in the first few years of her, first few months of the baby being born, goes and looks up at herself in the mirror because she doesn't recognize who this person is. And that's exactly why it said it's like a second birth, because you went through something so excruciating and then you are a new person and then you're responsible for this little thing that's just come out of you. So it affects body identity, it affects bonding and daily function. And in the last 4 years, especially post COVID, when people started resuming work and having, lactation has become a huge concern. A lot of the mothers are not able to have lactation and the babies are not latching onto it. And there's a lot of societal shame that is coming with it, where they're saying, maybe you should drink more milk, maybe you should, find a lactation specialist. Recently, I heard something that just blew my eyes off in a different context with a client, where he said, my grandmother went into the room when my wife was not able to lactate, and she just, pressed my wife's breasts everywhere and came back to see if my wife's breasts were even functional. He was like, she only told me about this experience after she came back home, but apparently, because the baby was not latching on to the mother in the hospital, the grandmother just did that. Breach of boundaries, breach of privacy. So many, many things where people think that it is okay to do this. It is not okay. It is very, very personal. Literally, apparently, the wife was so scandalized. He never understood why she did not want anybody to come see her in the hospital. She said, I do not want to see anybody, especially not a female. She made it very clear. She's like, no female of your mother's age, of your grandmother's age, your aunts, nobody is coming. My friends are coming, your friends are coming, and our younger cousins are coming. That's it. Because all the younger cousins turned up to take care of the baby so that she could sleep. So remember, there are so many things that people do not think twice before hurting. So PPD is not just because of the hormones. PPD is because of what is happening in this societal environment as well. And you cannot just diagnose yourself by yourself. I am sad. Yes. I am low. Yes. But I have postpartum depression. It, like I said, it happens to 25% in India, but you will have to still get diagnosed by somebody for the same. Now, a lot of people say, yeah, but this is just crying, right? Everybody cries. Now, there are some gorgeous, wonderful women on the call and some fabulous males. I have a question to ask. When anybody has told you that I'm in pain, how many of you felt understood and how many of you actually understood? Do you people understand when you're saying that you are in pain? And when somebody, because women absolutely depends on many aspects, but research in South Asia says women have extreme amount of pain tolerance. Now I'll tell you something that is very less spoken of, and all the mothers who had babies will know this. If the child is not suckling, they think that, oh, the child doesn't have teeth. Without teeth, the child can still bite the nipple and it will hurt. It is going to hurt like hell. And by the way, if you don't know, keeping your child in this position can actually almost mimic the fact of you having a heart attack, because you have to hold the child consistently. And remember, all of this is happening on no sleep. It is happening on constant crying in your ear. It is the child not wanting to go to anybody but being there. But what people are forgetting is the hormones are still impacting on the lactate glands and the nipples are extremely sore. And if the mother has given birth vaginally, there is tear in the vaginal muscles that happens, which is then stitched and sewed, and they just give you antibiotics for the same. There is something called as a husband stitch, which the entire world has been doing without talking about it, so that there can be sexual pleasure for the other partner without the consent of the female. Welcome to the other side of what happens in the medical field. I'm not trying to blame anybody. I'm telling you, it is not one. We are supposed to be aware about this so that we learn to support the people going through this better. And that is exactly why it might not look like always crying. You'll be surprised, a mother with, PPD can be functioning, feeding the baby, answering messages, posting on social media, taking videos of the child, putting the child in the brightest of the clothes, telling the love of my life and telling, I don't want to see you. And it's absolutely okay. There is one person who works in animal rescue. They said something very nice. They always speak about neutering and, degendering for the animals and especially the females. She says one thing. You'll be surprised how much even it's difficult for animals also to recover because they also go through PPD. I was amused when she said it. I was amused. So apparently, this is not something that is just to us. It's there everywhere. Why are we speaking about it? There is emotional numbness because there is a duality of thought process. There is disconnection from yourself because you don't know who this new person is feeling so many things for this little thing that is moving and shaking in front of you. You are scared because what if you put your hand on the baby and the baby suffocates? What if you suddenly move and the baby then wakes up from sleep? There is sadness, there is emptiness. There is something also called as an empty womb because suddenly you had this baby bump and now there's nothing inside your body. Even your body is confused that what has happened. So there's a lot of emotional numbness that hits like exactly a truck. Then comes the rage and irrationality and irritability because you are, again, that's exactly why it's important for men to step up and say, you might not understand what is happening to you. I see what is happening. It is absolutely okay. Take a step back. Or for sisters, for siblings to step up, for partners to step up, for fathers to step up, for mothers to step up and say, please take rest. Now, there's also impaired bonding. When a mother is going through PPD, it affects how the mother and the child bond with each other because there's a combination of shame and guilt, and that is seen in about 40% of the women who are going through postpartum depression. You'll be surprised. We are talking on postpartum depression. A friend of mine recently went to a doctor and she was talking about, oh, but I'm having heavy periods. And the doctor said, yeah, you should have a child. Your periods will then regulate. I'm sorry. I'm just sorry. Because it's that unexpected statements that come and hit you where you don't know where to go. And then everybody is telling you how to take care of a baby. Everybody under the sky has a suggestion. Everybody under the sky has a thought to say. Somebody wants to feed the baby honey. Somebody wants to feed the baby chai, sugar water. And here you are trying to be like, can I just not put anything inside my child because I don't know what to put inside me? You'll be surprised. There is a lot of trauma with food that a lot of women with PPD go through because they are just said, shut up and eat. Because this is not about you, this is about the child. The child needs enough milk, so you just shut up and eat. I very clearly remember that a lot of women who don't eat meat were forced to eat this because your body will be strong enough to go back to work. They were forced to have specifically red meat because it's supposed to bring in a lot of nutrition. Imagine this is so much of moving from your own belief system, your own value system. It is so, so scary, right? And then there's the hypervigilance, like we spoke of, right? And to folks who are talking about it, that empty womb is a very, very real thing. Along with that empty womb, the fear of hurting this child is also constantly there. This is what we call as intrusive thoughts. And mind you, they are not evil people. They are not baby killers. They are not possessed by evil. This is no Annabelle possession. There is no conjuring that is happening. But a lot of women have had thoughts of hurting the child, which is very, very normal. If you've not seen, again, please do try seeing it, where a lot of the animals in the wild, when there are too many babies and she's not able to feed, she apparently sits on one of the child and just suffocates the child and kills the child. Nature has its way of doing things because as individuals, as humans, we cannot really work on it. So we try working through it. Very scary thoughts, very scary thoughts. I remember a friend of mine telling me, do I even want this child? My sibling doesn't have a child. Should I just give off this child? I don't want this child. And this was the same child she yearned for so much. Now, there's other aspect of it that we call as somatic symptoms. While there is so much happening in the body, while there's so much happening in the mind, there is something that is somatic where the body is going through at a different level. The medicine, the speculum, all of that is one part of it. But on the somatic symptom side, there is headache, there is appetite loss, there is chest tightness, there is fatigue. And by the way, your entire body organs have moved like islands. Now they all have to move back. So that is going to take a lot of time. And did you know that there's a lot of urinary incontinence that happens after the baby is born? Because your abdomen has been pushed so much and there's so much of pressure on your bladder that your body is like, well, I prepared for 9 months for a baby. Now you've taken away the baby. I don't know what to do. What do you think is one of the most dangerous symptom in India with respect to PPD? There are many more, but just say. What could we guess? If we were to guess, what could be one of the most dangerous symptoms that we see in South Asian context per se? Any guesses? I spoke about decent number of thoughts. Suicidal thoughts, yeah, definitely that is of primary importance, where if that is there, you immediately get them to talk to a mental health professional and do not delay. Yes, harming the baby and self, very, very predominant, but we'll be surprised what the answer is usually. This is the bigger symptom. Not talking is the bigger symptom. And if you see a new mother posting too much, you should actually ask her, how are you doing? Not be like, oh, the baby is so cute, you are so cute. Ask them, hello boss, what is happening? Because this can be a way to recover from it. This can be a way to cope from it. So just because somebody is showing on the outside doesn't mean it. Why are we doing this? Because there is no language. Can we just take a moment and ask ourselves, there is no Indian language that has a colloquial equivalent of postpartum depression in a country with 29 states. There is no regional language and word for this. Why? Because you will then be called mad. Your child will be taken away from you. This child that you're so territorial, so protective about will be taken away from you. And there is also the other thing. If you don't show up, if you don't do your household chores, what if there's a lot of other aspects that coming? Marital stability is shaken away. There's family dynamics. And mind you, if there is already a child that is 5 to 6 years and then you have a second child, now you have to show up for the older one, so the older one doesn't feel abandoned. The older one doesn't feel like somebody has taken away and that this new person is an enemy. And there's also the idea that you got to show up. This is your role as a female. This is your role as a mother. There's an inherent expectation that comes. Yes, thank you so much for that. That there is this, you just have to be happy. And that's what it is. It's the gratitude trap. You have a healthy baby. What more do you want? And what about my health? Isn't nobody going to ask what is happening to me? But remember, this can exist at the same time. And if I were to put it in a slightly more zesty way or a way to remember, this is like having PMS on steroids. Women know what PMS is. PMS on steroids is like 10x of what you're feeling. You're happy that you got your periods. I don't know if many of you know, and if your girls in your life and the women in your life have told you, we are happy that the periods come. We are like, finally got my periods. And then we are like, oh, this damn thing. Immediately. It is not even 30-second gap. We just go, that is a single statement. That's because this is really what it is. You cannot run away from the duality of what it does. This is so scary, where so many people are there. Everybody is dropping by, everybody is coming to see you, and they behave like you should be grateful because they're all coming to see you. Like, boss, this is too much of effort. Just allow the lady to sleep. Like, just let her sleep. Everybody wants to touch your baby. If you're telling, please wash your hands, wash your legs, and then touch my baby, then you are being the territorial mother. You are behaving like only you have had a baby for the first time under the sky. Boss, it is her child, boss. She gets to do whatever she wants. For 9 months, she's held that child inside. She's birthed that child. It is her right to do what she wants with that child, and she can protect it as fiercely as possible. And in the wild, it's interesting that the female lion doesn't allow the male lion also close by. It's like, no, you're not coming closer. And that's respected. Ironically, a lot of times we don't really think about the idea of respect. Now, who is more vulnerable? PPD doesn't choose. It is not about a particular sect of population, not a sect of population. But then, if as a person you've had prior history of anxiety and depression, which according to WHO by 2030, 30% of the world population is going to be having depression. Now, if as a person you've had historical aspects of having depression, that is a higher risk for getting PPD. If you are having extreme conflicts in your relationship prior to having the baby, because apparently a baby solves everything in a conflicted marriage. Can we please take a step back and see that it only adds chaos to everybody in it, and resolve and then have a baby? Stressful life events during pregnancy, because it is 9 months long, the unpredictability of life is so much. Unfortunately, I'll tell you one very strong incident that stayed with me is a friend who was carrying twins, lost her father in the 9th month of her pregnancy. She didn't even know what she had to feel. If she sat down, she couldn't get up. If she got up, she couldn't sit down. She was like, I can't even grieve because and she had two babies inside her. She's like, I feel like I'm suffocating and dying. So she had to keep her grief inside. And the guilt of not grieving her father even more added to her postpartum. Infant temperament and NICU admission. Now, this is something that's happening a lot with the current AQI, with the current pollution, with the water availability, with the scarcity, with everything that the environment and climate crisis is doing. A lot of the children are being born with immediate aspects of jaundice, pneumonia, breathing difficulties. So imagine there is separation anxiety where the baby is just taken away and put in the NICU and you don't know what to do. Now, a lot of women are constantly, there's excessive milk flow or there is no milk flow, there is arrested, there is fear. We don't know what is happening. Now, something that I would like all of us to also be extremely considerate and sensitive about is if a person has gone through a childhood trauma or has had childhood adversity, where they lost a parent very early, where there was child sexual abuse, where there was traumatic loss, where there was physical trauma, where there was accidents, where there was disaster, where there was disease or upgrowing or growing in the hospitals, the very idea of being in the hospital can cause a lot of panic to some people. So you will, and that is exactly why we are talking about bringing in mental health into every aspect of medicine, because complete history or holistic care is what we are focused on. And now there is also, like we know, the trend of social isolation and nuclear family settings as well that is impacting. Right. Now it reaches beyond the mother, because it is a family health event and this is not something everybody speaks about. Why are we saying that it is a family health event? Would any one of you have a thought on that? The mother gave birth, but why are we calling this a family health event? Any thoughts? You are all getting the answers on point. So why do we think this is happening? Shouting at the kids and husband, anger issues, yes. What else could that be? Interestingly, you do not want anybody to touch you. You do not want anybody around you. It could be your best friend, your mother, your daughter, anybody. You're like, no, I don't want anybody right now around me. Your libido falls. Your sexual intimacy falls. You do not want even physical intimacy with anybody. You want silence. You do not want light. And now I'd like to add a small thought process. If you're on the neurodivergent spectrum, if you are having either autism or ADHD or ADD, And you give birth to a child, you do not want light also. You are like, I don't want light, I don't want sound. Can I just exist in this? Absolutely. So there is childbirth, there's feeling of being unheard, too tired to get out of bed. Absolutely, absolutely. Because there is the idea is if there the PPD is not, if the postpartum depression is not addressed, 40% of the babies have delayed language development because the mother is not talking. The mother is silent. She's trying to talk inside and she doesn't want to cry. She's stifling and crying when the baby is sleeping. So, if the mother is not attentive to the baby's needs, the child is going to learn to retract and not be very, very forthcoming with their needs. So it disrupts, but it is definitely dealable and reversible when partners step in. 10% of partners develop postpartum mood disorders. Very interesting, no? When we're talking about partners of all kinds, we're not talking about partners of a particular gender. A meta-analysis that was conducted where fathers are the invisible patient who are expected to support, never to need. Now, this is also huge societal need on the fathers as well, right? That you just show up. I really believe this is an ongoing joke between my team and me that we need to do two things in life. One is to have centers that prepare people to be parents, centers that train human beings to be adults. I don't think we do this enough because we are just thinking, oh, you're 25, 28, 29, so you got to get married, you got to have a child. Yeah. Who's preparing you to have a child? Who's telling you what to do when you have a child? There was a professor of biotechnology, biomedical engineering who I met when I was doing my research. And she said something interesting. She's like, I literally know what happens and hence I'm prepared. I know whom to reach out to. I have pasted a list of all the people my husband can reach out to when I am not responsive so that he doesn't feel left out. Psychoeducation, supporting and preparing people is a game changer. Now, in the relationship itself, right? As ma'am rightly said, relationship versus relationship balancing. 50% of them report significant marital strain. A lot of infidelity happens during this time because you feel like, oh, the person is not showing up. There's no more love left for me. The child and the parent or the partner can be angry at the child because they've taken away their loving partner from them, and the constant attention is only on the partner. Now we're going to do a small scale, okay, to all the fabulous women who've had babies and who in the recent past can do this. To the ones who've had it at some point of time, we can also figure out if you've had it. It is actually called as a small scale on the Edinburgh scale. Is it very gender inclusive? It is not for individuals who identify as males. It is only for individuals who identify as females and were assigned female at birth and have given birth to babies. This is a little bit more useful for you. Please do so. Very tiny questionnaire. Just do it at the end. Just press submit. It'll give you a score. This is completely confidential. Nobody gets to see the results other than you. So please don't hesitate. And because you're doing it on your own devices, it's absolutely safe. And the website also doesn't collect these responses. And by the way, there's something called as this postpartum hair loss. This identity killer where the woman doesn't want to go out at all because she's like, what hair do I have left? And this is all the hormones from inside that is doing it to her. They do not want to do anything. They do not want to get out. They don't want to get dressed. They don't want to look at their faces. They literally are right there. And then they're like, can I just cover into the corner and not do this anymore? So to folks who have done the scale, this is just the interpretation. Please do not think that this is the end of it. This is just a scoring, which can move because we are very, very dynamic as individuals. You could feel a particular way today. You can feel a particular way tomorrow. And that is why psychology is inclusive and it is fluid. There are no absolutes in psychology. Please do not think that this is the end of it. You can move. This is just for us to understand that if somebody is falling on these scores, you will have to get support. Now, I'd like to add a small thought process here, okay? Imagine a woman who's just given birth like 3 weeks back or 3 months back, and her parents have fallen sick, or the other older adults at home have fallen sick. This is March. This is your child's examination time. Your bosses on the other end are like, this is only 6 months leave. You have already run down with 3 more months. You have 3 more months to do. What do you think she could be thinking? She needs caregiving, but she's also the caretaker here. She's caretaker for 2 generations. 2 generations of babies. The older generation who are the second babies and the actual baby who's a baby. And then there is an adult child. There is an at least slightly older child who requires support. There is work-life balance. There is her PPD. What do you think she could be going through? People who worked with me, they hate me for one reason. They're like, at the end of it, she always makes you cry. I said, yeah, because when you end up asking the right questions, it touches us. And as people, that shows we still have a lot of humanity left in us. Right. What do you think a mother who's in this situation could be going through? I'm sure all of you have been privy to some of these thoughts from your siblings, from your sisters, from your best friends, from your aunts. What do you think they could be going through? There's one word that English has. It's called exhaustion. Absolutely. She's just not going to show up. And there is a bad word that is also there that is also used. Can I just disappear? This is not her wanting to kill herself. This is not suicidality. Can I just disappear and not play so many roles? If, like, like one of you saying, if I'm pulled in all directions, imagine how that feels. Your two legs, one person is pulling one hand, one person is pulling the other hand, somebody is pulling both your legs, and somebody is trying to pull you from the center. What are you going to do? Where are you going to show up? And burnout can happen even with consistent PPD, and that leads to long term depression. Absolutely. Constant pressure to manage, and then the never ending to do list. So there is a saying, you can see a happy woman, you can see a smart woman, you can see an accomplished woman, you can see an ambitious woman, but you can never see a calm woman. Because at the end of the day, you're thinking, what is there in the fridge? What has to be cooked? Whose examination is coming? What renewal has to be done? Whose medicines have to be refilled? The to-do list is never ending. And now when there is so much of caretaking, it is even more difficult. And remember, there is a question on self-harm that comes, right? Immediate attention. Always overdo than underdo. Ask. Do you feel like hurting yourself? It is okay to ask this question. If you cannot do it, direct them to a mental health expert who can support them with the same. Now, this recovery aspect is very, very real, and it's evidence-based, because with the right support, now that I've scared you all enough, with the right support, there is enough amount of recovery that can be done, but it is an ecosystem. It is not a one person thing, right? It is an ecosystem that happens, and that has to be gone through with that. We do have cognitive behavior therapy that really works with a lot of irrational pattern breaking that really, really works. There's also the interpersonal therapy where it is understanding what are the challenges and then is equally effective as postpartum depression and works, right? Now, there's also the medication. By the way, this is a very big myth that many people have, that lactating, breastfeeding mothers cannot take psychiatric medicine. Absolutely not. You can take these medicines under the guidance of a good gynec, a urologist, and psychiatrist. I have prescribed, along with the help of a psychiatrist, given a lot of women medications for sleep, for their moods. And it is not about whether it is right or wrong. It's more about, is this helpful? Is this going to help the entire thing as an ecosystem? And then there is the peer and community support. And it is said that even if you just keep checking in on people, there's a friend of mine, I used to do this with her. I would just give her video calls. I would say her, I'm right here. I'm keeping an eye on your baby. Sleep. There was nobody around her. This was a nuclear family. I said, have a baby monitor. Give me access to it as well. I'm on the video call. Just sleep. If your baby wakes up, I will give you a call immediately, loud enough for you to listen. She was like, I don't know, dude. It's just so comforting to know that something like this can happen. So do not think about some grand acts of care. Smallest acts of care absolutely matter. Now, what do we think can be our role in recovery? As people, what do we think we can do? What are your thoughts? To all the wonderful folks who are here, I'm sure you all would have wanted some support. What could that look like? I think hugs are very good. Take consent and hug them. I think that is so relieving. And that's something I've always believed. To validate her feelings, absolutely. Spreading awareness, I think folks here are doing a good job on that. Oh, yes. No unsolicited advice. I'm going to tell you all a very nice technique to do this. Not just for PPD. In general, in life, when somebody says you and gives you unsolicited advice, just say, I'm sure you're coming from a fabulous place. Thank you so much. Nothing, just don't say anything. This is just going into a rabbit hole if you give into that. You don't need to absorb it. You don't need to just listen. Just say that and walk away. To empathize with her thoughts, yes. The partner showing up. Self-care, absolutely yes. Recent discovery, 3 years back, is if you can just give them respite of 10 minutes in between 2 to 3 hours of care, and this is anybody else, it goes a long way. Offering support of what is doable, have some empathy, talking, writing, grounding techniques. dude, can we just leave them? Like, let's not just do anything. Just take the baby for some time, or keep the baby with them and just allow them to sleep in peace. Like, not have loud noises, just allow them to sleep in peace. And I love what this says. Silence, that's exactly what I'm telling. Ayo, silence. Like, just leave that mother in peace, man. Don't tell her, wear that clothes, wear this clothes, apply. She doesn't want to do anything. Just. And by the way, there's a lot of food shaming, like I said. If the mother wants to end up ordering some junk at some late night and wants to eat, that is also a problem. Don't drink Coke, don't do that. She knows, yeah, it's okay. She knows. She's more worried about that baby than anybody else. But learn to understand where she's coming from as well, right? Yeah, no, I think this is so important. I'm so sorry that so many of you had to go through this. This lactation and the unsolicited advices around it are so painful, because this is body shaming, and this is you telling the mother that she's not good enough because she's not able to produce the milk. But there can be so many reasons why the milk doesn't come. And you'll be surprised. I have known so many people who've had surplus milk production 3 months after the baby was born, that these mothers started donating milk to milk banks. And that's why medicine and medical technology has come so far off, that there are decent formulas that are available. Now, the chaos is so intense, right? On one side, the pediatrician and the gynecologist are telling, if you're not lactating, it is fine, just give the bottle. When you go back home and tell this thing, people at home are like, hey, the doctor doesn't know anything. This, all of them also went through. My fourth cousin's daughter also went through the same thing. She had me. Doesn't work like that. Individualized care is where medicine is heading to, where psychology is heading to. We will have to understand that this is absolutely individualized care, tailor made care, if you can put it that way. Now, you do not need to understand, PPD completely. You just need to show up, and show up consistently. And I love those last two words, without an agenda. No ulterior motives of showing up for the mother. No telling that I have done, no bringing this back and guilting her later in life. I showed up when you had a baby. You are not showing up for me now. Bad behavior. I learned this from my friends. Bad behavior. Do not do this. And I'm so sorry for this again, that a lot of times the baby formulas are made so that the mother's body gets a respite. It is not a bad thing. So if you find people around you not supporting that, please stand up and voice for the mother and for the baby, because this is very important. And current baby formula, choose. There are many alternatives. There are many alternatives, safe alternatives. And this is exactly what I meant. Those 9 months, research a lot. Support your pregnant friend, mother, sibling, whoever, by asking them, oh, I saw this about pregnancy. I saw this about baby birth. I saw this about lactation. Maybe this will help. Sit down and come up with techniques for them. Now, do more of this. Ask, how are you really doing? I love how that one word, no, that just that one word, really doing, can, you'll see half the time they're crying. Just let them cry. Don't ask them what is the problem. Even they don't know what the problem is. Let them cry. It's just the hormones. Sit with her feelings without fixing. Very important. Sit with those feelings, because those feelings are super important. Take the baby for 3 hours so she sleeps. I love how the number is 3 hours. Why? Because the first half an hour she's not sleeping. Second half an hour the body is adjusting. Third half an hour she at least, and then somebody will call. Fourth half an hour she have to get up and she'll pee. So she technically gets only half an hour to 40 minutes of sleep. The rest, all of it is just adjusting so that the body sits at a place. Now, say, let's find us someone to talk to. This is so important, because as a third person, and there was this particular patient's husband who said this. He said, I think, the fact that we got a therapist involved right from the time my wife was pregnant has prepared us for the best. There are people called as birth doulas. You can involve them right from the time you've gotten pregnant, so that there is a third person who's navigating these conversation and who acts like a buffer. And start telling this as many times as possible, that this happens to every mother who's going through, or at least happens from 1 to 4 mothers. Now, no comparison. Avoid comparison, telling I managed fine, you will too. The situations are very different. We are in different generations. Avoid offering solutions when she just needs your presence to sit, right? Avoid saying sleep when the baby sleeps. Dude, she's going to sleep when she's also sleeping. Like, how is that not working? Avoid frame therapy as failure or weakness. You have so much to be grateful for. She knows that. Most definitely knows that. Now, this is very important. No mother should heal alone. Absolutely not. And this is exactly why We have some places where you can go to seek help. I would be very, very glad if you folks want to take a screenshot of this, keep it with you. And when a mother's going through this, you want to share it with her. When a partner's going through this, when a father's going through this, you want to share it with them, please feel free to do so. All of these are free confidential helplines present across the country in different colloquial languages. Very, very important to find that. And I call specifically the TIS Mumbai helpline is for individuals who are on the LGBTQI spectrum and have babies. It is specifically more LGBTQIA friendly. So there is that for you. Samaritans and Vandravella also connect you to local psychiatrists who can help you if you do not know who is a good psychiatrist in your area. Roshni Counseling Center does the same as well. You can call them and ask, would you be able to connect me to somebody in my city, because they have directories of people who do this. That's my dog, who's probably listening all my life patiently. Thank you so much for being a fabulous audience, and thank you for engaging so much. Thank you for responding, because I think that kept it going. I'm extremely grateful for all of your presence, and I absolutely appreciate all of you being here.